at one of England's biggest NHS trusts that could put patients' care at risk. This report comes as part of an inquiry into serious bullying allegations at University Hospitals Birmingham NHS Trust, and it follows claims that junior doctors were threatened if they raised safety concerns. Our correspondent Becky Johnson joins us now from Birmingham. Becky, give us a bit more detail as to what the review has found.
This is a really damning review that's found a long-standing culture of bullying and a toxic environment at what is one of the largest healthcare providers in Europe. University Hospitals Birmingham employs over 22,000 people. It's one of England's largest NHS trusts, and the report's revealed extensive complaints from staff around issues like bullying of staff, including junior doctors, a fear of retribution if concerns were raised. In fact, one survey found that only just over half of staff felt that they would be safe raising concerns with managers. It found that there is a higher than average level of vacancies. As of November last year, over 13% of nursing posts in this trust were vacant. The England average is 10%. And really worryingly for patients, it found that this trust has a higher than average mortality rate. In other words, more patients are dying than would be expected within a trust of this size. Now, the report says any continuance of a culture that is corrosively affecting morale and in particular threatens long-term staff recruitment and retention will put at risk the care of patients. It goes on, if the cultural environment at UHB has not already affected mortality, it is likely to be affecting the patient experience and morbidity. Now, the report outlines one very tragic case, the death of Dr. Vaishnavi Kumar last summer. Now, she was a junior doctor working here at the Queen Elizabeth Hospital in Birmingham. Her parents say she was bright, fun-loving, but all that changed when she started working here. They say she became tearful often after work. She would talk of being belittled at work, of being laughed at. And then in June of last year, she took a fatal overdose and she left a note for her parents blaming the hospital. Now, within the report, it says that the way management dealt with the death of Dr. Kumar angered many junior doctors. In fact, it was described as callous. There was no senior management present at her funeral. In fact, they didn't even contact her family until 2 months after her death. Shockingly, 26 days after her death, a member of management that didn't know she died emailed her directly to ask why she'd been removed from her post and if she was still being paid. And very soberingly, in fact, the report says that she wasn't the first doctor at this trust to die by suicide. Now, her father, who's also an NHS doctor, Dr. Ravi Kumar, has been saying change must come as a result of this damning report. This is what he had to say.
Our life stopped on 22nd of June. And it's very hard to, each day is a struggle. Now, my main worry is to stop it happening to others. And that is why I want to bring this forward, so that people realize that there is a toxic atmosphere.
Now, we have had some reaction from the chief executive of this trust. He says we fully accept the report's recommendations and welcome the additional assurance that's been asked for through further independent oversight. There are a number of significant concerns that we need to and have started to address. We will continue to learn from the past as we move forward. We want to develop a positive, inclusive work environment where people want to come to work in a place that they are proud to work in, to do their very best for our patients. So that's the response there from the chief executive of an NHS trust found to have a culture of bullying, a toxic culture that could be putting patient safety at risk.
OK, Becky, in Birmingham, thank you very much. Let's take you straight to